Welcome. My name is Orlando Ramos. I'm the program manager here at St. Clair Social Services. Today I will be talking about behavioral health. The term behavioral health in this context means the promotion of mental health, the resilience and well-being, and the treatment of mental and substance use disorders. Let's not forget the support of those who experience and or are in recovery from these conditions along with. According to the National Alliance on Mental Illness, 46.6 million adults in the U.S. experienced some form of mental illness in 2017. That's nearly 19%. In this context, there are 5% chance you. According to the DSM, that is the Diagnostic Statistical Manual, defines a mental health disorder as a group of symptoms characterized by clinically significant disturbance in an individual thought process, emotion regulation, or behavior that reflects a dysfunction in their mind, body, or developmental process. This means that a person who is experiencing mental illness is likely to think, feel, and behave differently. Understanding mental illness will help you identify symptoms and respond appropriately to an individual's mental health. So in the next few slides, I will briefly explain the underlying function of mental illness and its influence on our cognition and emotion. Now, cognition refers to our thinking skill. It helps us perceive, acquire, understand, and respond to information such as paying attention, remembering, solving problems, organize and reorganize information. On the other hand, emotions are conscious mental reactions such as anger or fear. It is a subjective experience that is accompanied by physiological and behavior changes in the body. Individual who is experiencing a mental illness, such as an anxiety disorder, may have a cognitive and. To give you an example, individual who is suffering from an anxiety disorder anticipate future threat resulting in excessive fear. Repeated exposure to that fear may predispose that individual to interpret a non-threatening event as threatening, resulting in emotional and behavioral disturbance. Confronting the behavior will only increase that person's anxiety. In other words, that individual who is experiencing mental illness may not respond to everyday events in a manner consistent with normal brain functioning. The presence of cognitive distortion and emotional. Previously, I stated that there's a 5% chance of you meeting someone today who is experiencing a mental illness. If you are a healthcare worker or a social service employee, the probability is much higher. You may already have the skill set to identify and treat mental health symptoms. Regardless of your training, mental health treatment is always evolving. In the next chapter, I will discuss two key components in managing individuals. First, it is important to understand self-awareness. Self-awareness is a precursor to regulating our way of life, modifying behavior as needed. It involves self-observation of our own personal experiences without biases or avoidance. When we are aware of our needs and limitations, can we constantly weigh our options in caring for others without the need to neglect or exploit them to meet our own needs for intimacy, esteem, or dominance? Without self-awareness, we risk acting out repressed emotions and needs in ways that is irresponsible and harmful. This may be costly to ourselves personally. The second component in this chapter is eliciting behavior changes in people experiencing mental illness through motivational interviewing. MI. MI is a direct client-centered counseling style for eliciting behavior change by helping individuals explore and resolve ambivalence. Quote, in 1991, William R. Miller and Stephen Rothman wrote a book titled Motivational Interviewing, preparing people to change addictive behavior. It explained how to talk with people about their alcohol and drug use in a way that respected their ability to decide for themselves whether they wanted to change. In the book, the author described the spirit, core attitudes, and belief of this approach, and specific skills and strategy. There are 5 principles of motivational interviewing. Number 1, express empathy through reflective listening. Number 2, develop discrepancy between client desires or wishes and their current behavior. Number 3, avoid argument and direct confrontation. Number 4, adjust to client resistance rather than opposing it directly. Number 5, support self-efficacy and optimism. To learn more about MI, please visit. The focus of the next chapter is on substance. There are 10 classes of drugs: alcohol, caffeine, hallucinogen, inhalant, opioid, sedative, hypnotic, anxiolytics, stimulant, and tobacco, that if taken in large amount can directly activate the brain reward system, which is involved. An individual experiencing a substance use disorder may exhibit cognitive behavior and physiological symptoms that inhibits their self and social control, resulting in risky behaviors. Furthermore, individuals with pre-existing mental illness are more likely. In the previous slide stated that substance of abuse activate the brain reward system, which is involved in the reinforcement of drug-seeking behavior. The brain reward system is important because it helps us recall pleasurable experiences, such as the delicious slice of chocolate cake you stored in your refrigerator for later. Without the brain reward pathway, behavior that elicit pleasurable moments, like the consumption. Behavior that is important to our survival is adaptive and natural. However, individuals experiencing substance use disorder bypass the natural activation process in the brain reward system, resulting in changes in their brain circuits. The behavioral effect of these brain changes may be exhibited in the repeated intense. Understanding these brain changes will make a difference in your approach to individuals experiencing a substance use disorder. The main feature of a substance use disorder is the individual continue using substances despite significant substance. There are many evidence-based counseling models to elicit behavior changes in individuals experiencing substance use disorder. Cognitive behavior therapy, CBT, has shown to be one of the most. CBT works by developing discrepancies in an individual's distorted thought processes, an attitude that reinforce destructive behaviors and emotional deregulation. CBT enables individuals to identify how situation, thought, and behavior influence emotions. By changing dysfunctional thoughts and behavior, emotion will improve. CBT is non-confrontational and it provides the individual with the opportunity to reflect on rational thinking. To learn more about CBT, please visit www. So in summary, behavioral health includes mental health disorder as substance use disorder. The manifestation of symptoms of individuals experiencing a behavioral health disorder varies among people according to the type of disorder, coping skills, cultural influences, personal experiences, and adaptability. In either case, learning how to recognize behavioral manifestation of mental illness and substance use disorder will make a difference in how you approach someone who is suffering from a mental health disorder.